for giving me this opportunity. I am Dr. Sabha Rupani, a general surgery resident from Kalinga Institute of Medical Sciences, Bhubaneswar. My topic of the paper is occupational exposure to blood and body fluids among healthcare workers in Department of General Surgery in teaching hospitals of twin cities of Orissa. Occupational exposure to blood and body fluids is a serious concern, especially in surgical departments. WHO has reported incidence of 2.5% HIV cases and 40% hepatitis B and hepatitis C cases among healthcare workers due to occupational exposure. In developing countries like India, the proper reporting method for exposed professionals is not available, which leads to underestimation of exact magnitude of such incidences. The aim and objective of my study is to estimate the incidence of blood and body fluid exposure in Department of General Surgery and to identify who sustained such injuries, percentage of people taking post-exposure prophylaxis, notification to higher authority and its repercussions. Coming to methodology, an online survey in the form of Google Forms was circulated among healthcare workers in the Department of General Surgery in teaching hospitals of Bhubaneswar and Cuttack, that is KIMS, AIIMS, SUM and SCD. Anonymity of all individual healthcare workers was maintained. My study type is a cross-sectional survey study. This is a glimpse of the Google Form questionnaire that was circulated among everybody. My inclusion criteria includes all the healthcare workers associated with Department of General Surgery in teaching hospitals of Bhubaneswar and Cuttack who successfully filled the questionnaire. And my exclusion criteria includes incomplete forms and healthcare workers outside teaching hospitals of Bhubaneswar and Cuttack who randomly chose to fill the form as it was circulated. Finally, coming to the result, I got a total response of 364, out of which there were interns, postgraduates, professors, nurses and OT staff, all of General Surgery Department. Out of these, the maximum exposure was seen among postgraduates, accounting for 95.93%, and the least exposure was seen among professors, accounting for 41.30%. Out of all the people who responded, 92.86% healthcare workers were exposed to blood or body fluid, out of which 51.10% were male and 48.90% were female. Coming to the type of accidents leading to these exposures, there were needle prick, splash, blade, others, and few of them responded all the above. The maximum cause being needle prick and splash, both accounting for around 39%. The exposure was either in the form of blood, accounting for 74.83%, or body fluid, accounting for 72%. Coming to the status of patient, out of all the people who were exposed, 23.05% healthcare workers were exposed to a viral marker positive patient, and 11.36% healthcare workers were exposed to patients whose viral marker status was unknown. Coming to local toileting, all the healthcare workers who were exposed did local toileting, that is washing the wound area with running water, soap or spirit. Out of all the healthcare workers who were exposed, only 29.22% healthcare workers chose to notify to higher authority, and only 34.09% healthcare workers who were exposed took post-exposure prophylaxis. Coming to hepatitis B vaccine, out of all the healthcare workers that we surveyed, a total of 19.81% healthcare workers in Department of General Surgery are still unvaccinated for hepatitis B, and 6.49% are incompletely vaccinated for hepatitis B. Coming to discussion, in the NHS in UK, it is compulsory when a healthcare worker sustains an occupational injury, the incidence is reported and the local occupational injury protocols are followed. This allows the appropriate occupational health staff to conduct a risk assessment and evaluate the need for post-exposure prophylaxis. A full risk assessment involves a blood test of patient and healthcare worker along with immunization and prophylaxis. Legal measures are also indicated to address compensation for healthcare workers who contact bloodborne pathogen as an occupational hazard. Early prophylaxis administration has resulted in decreased seroconversion. Previous studies have suggested that adherence to these protocols among surgeons is very, very poor. Coming to conclusion of my study, in my study population, postgraduate students had the highest exposure, accounting for 95.93%, and professors had the least, mostly due to respective work experience and expertise. Though the total exposure rate is 92.86%, notification to higher authority was very less, accounting for only 29.22%, and post-exposure prophylaxis rate was also extremely low, accounting for 34.9%. Out of the total exposed, 23.5% were exposed to a viral marker positive patient, and 11.36% of exposed had unknown patient status. Finally, coming to hepatitis B vaccination, although Hep B vaccination is known to all, 19.81% are still unvaccinated and 6.49% have incomplete vaccinations, putting themselves to occupational risks every day. Towards the end, I would like to take this national level platform as an opportunity to give a take-home message. As surgeons, it is important for us to take care of ourselves before taking care of our patients. Henceforth, I urge everyone to ask for an occupational exposure center in their hospital. Also try to inculcate no-touch technique in the theatre, maintain the OT decorum, and educate everyone about exposure to blood and body fluids, so that by next ASACON, the numbers in the graph changes. I also request all those without or with incomplete hepatitis B vaccination to get vaccinated without any further delay. These are my references. Thank you.